Sigmund Freud's creation of psychoanalysis actually began when he wanted to explain the hysterical symptoms of his patients. After helping Joseph Breuers successfully treat a patient suffering from hysterical deafness, disorganized speech, and paralysis with hypnosis, Freud developed the belief that the symptoms were actually a conversion of a patient's underlying emotional conflict into physical symptoms and concern. After observing the majority of his patients suffering from this disorder were women, Freud developed the theory that centers on the needs of the girls during the phallic stage, ages 2 to 5, where Freud believed that girls develop the electric complex, a pattern of desires where all the girls develop sexual feeling for her father and rivalry feeling toward her mother. Freud theory state if parents overreact to the girl's sexual feeling, the electric conflict will remain unresolved. This then leads to life full of sexual anxiety for the girl, who will develop the unconscious needs to hide anytime she begins to feel sexual feeling. Today, psychodynamic theorists build on a Freud theory, dropping the heavy focus on sexual feeling. They apply the theory to any unconscious conflict carried from childhood that cause anxiety that can be converted into more tolerable physical symptoms. They they have proposed two mechanisms that are work with the SSD. One mechanism is for primary gain. With this mechanism, individuals who suffer from physical symptoms derive primary gain when their symptoms keep their internal complex of awareness. Mechanism 2 is for secondary gain. With this mechanism, individuals derive secondary gain when their symptoms allow them to avoid unpleasant situation or receive sympathy from others.